Welcome back to the next piece of our process here, exploring the Wim Hof wave breath. And again, if you're not doing Wim Hof Method right now, these processes are great for you, just for your breathing, for your general well-being. But if you've been following along, the question that we're really looking at this point is, what does it mean to breathe into the head? And if you want more discussion on that, I suggest you go back to the previous couple of videos. There was a video that was the title, what does it mean breathing in the head? And then the part 5 process, which began to look at the way the head moves while you're doing the wave breath. This time, I'm gonna really help you focus in on what it means to find the spaces in the skull that the air can go into, or at least we can imagine that it goes into. Can't really verify it, but I think you'll feel something interesting as you follow along. I'm also linking for the second time the videos that you may have seen if you looked at the previous part, but just a couple of quick anatomy videos on YouTube that'll give you some imagery for what are the spaces inside the skull that we can imagine we're breathing into. But you don't necessarily need that to just follow along. I just want to mention 2 things about what you're about to be guided through because they're a little peculiar, but I think they're both useful. First of all, I'm going to use a process that involves breathing into one nostril. You may have encountered this in other breathing practices, but it's going to be kind of funny because I'm going to ask you to block one side of your nose, but also to block one eye and one ear. That's going to help you resonate the breath into your head in a particular way, which you'll see. But just so you know ahead of time, this is what it's going to look like. You're going to use one thumb to block one side of the nose, and then you're going to sort of spin your hand like that so it can cover the other eye. And you're going to need to really make sure you leave a space here so you're this side of the nose, which you can barely see right now, I can still draw in a breath. And then the other hand's going to come to cover the ear. So even when I do this, my voice sounds different. It resonates differently, and it's going to change the feeling of your breathing also. Now, as you can see, you can do that on the one side and you can do it on the other side. And quite often, many of us find that during the day, there's moments where one nostril is more open and we can breathe more clearly through one side of the nose. So please do just pick the side to remain open where you are breathing freely, or else what I'm gonna show you is not gonna be very effective, and it's frankly not gonna be that comfortable to do. Second thing about this is because there's 2 sides, logically you could do one side and then do the other, but I try to keep the processes that I'm showing you in these videos down to around 10 minutes, and for that reason I'm just going to guide you through one side, and that means that we can go into more detail with what we're doing, but before you just immediately go to do the second side, what I would encourage you to do is to actually spend a little time feeling the difference between the 2 sides afterwards. And if you never did the second side, you'd be just fine. In fact, this is something in Feldenkrais Method that we do often, is to work on one side and really get the nervous system's attention because of this strong difference in feeling between the 2 sides that's produced if you don't immediately go to the second side. So I'll encourage you to check that out, but then of course you are welcome to either replay the video or just, as however you remember them. I'm sure it'll be fine. You just go through the second side. Okay, so that's just a little getting you oriented, and now let's go into it. Make yourself comfortable on the floor and just begin paying attention to your breathing. Breathe through your nose and see if you can sense whether you're taking in more air through the left nostril or through the right nostril. And now, as you continue to breathe, bring your hands up to your face and cover your eyes in order to block out the light. So you might rest the heel of your hands on the bone just below each of your eyes. And you could have the fingers on your forehead above. You might even overlap the fingers so that you get a nice seal that keeps the light out. Make sure that there's still plenty of room to breathe through your nose. And just imagine, even though of course you're breathing down into your lungs, imagine that with each breath you're filling the space inside your head. Now, as you do this, just pay attention to how does that idea actually translate for you. You've blocked out the light, but you could imagine that as you're looking into the darkness behind your eyelids, that you're actually looking inside yourself. And now return to this idea of breathing in through one nostril. Just either side, but think that as you breathe in through that one side of your nose, that you're filling one side of your head. Maybe that you're breathing into one half of your brain. Imagine the space from the midline of your face going back behind your face and all the way to the back and all the way over to the ear on that side. And just notice how this changes the experience. Of course, you're still breathing through both sides of your nose, and if you were in fact breathing into your head, maybe you'd be breathing into both sides of your head, but you just imagine, you pay attention to the one side. And then bring your arms back down to rest on the floor, and just take a moment to see if something feels different in one side of your face or on one side of your neck. And then again, bring your eyes, or rather bring your hands up to cover your eyes, just as you were doing before. And now think of breathing in through the other side, as if you were breathing into the other half of your head. And then, with each breath, think of breathing into one side and then breathing into the other side. Again, you don't really need to know entirely what this means. Just invite yourself into the process and see what happens. What sensations do you feel when you think of breathing into the right side of your head? What sensations do you feel when you think of breathing into the left side of your head? And just take a few more breaths like this, but just try to get a sense for yourself. Which side feels easier? Which side feels clearer or more comfortable for you? Because what comes next, you're going to be asked again to breathe into one side. And so you want to know which side of the nose you're going to breathe into. All right, so rest your arms on the floor again. And maybe just for a moment, bend your knees and stand your feet. And just gently rock your pelvis a little up the floor and a little down the floor. If you've followed the previous parts of this process, this will be a familiar movement to you. And just see if you can allow the movement to pass up through your spine so that your head also gets pushed a little up the floor and down, with your chin moving towards and away from your chest. And just notice as you do this, the feeling inside your head. Okay, let that go. You can keep your feet standing or you can lengthen the legs again. But now decide which side of your nose that you're going to breathe through. And you're going to bring the opposite hand up to your face in a moment. So if you decided you wanted to breathe in through the right nostril, you're going to be using your left hand. And if you're breathing through the left nostril, you're going to be using your right hand. Bring your hand up in front of your face so that you are looking at the palm of your hand. And now with the thumb, block your nose on the same side. So the left hand would block the left nostril, or the thumb of your right hand would block your right nostril. And when you do this, the rest of your hand is on the other side of your face, isn't it? So now see how you could sort of spin your hand around your thumb, and you could use the rest of your hand, your palm and your other fingers, to cover the other eye. And so you'll have one eye covered, and the nostril below that eye is the one that's open and breathing. So just breathe here and get used to this idea, but close both of your eyes now. And just feel that you're breathing in right below your eye. And feel or imagine the air moving behind your eye, behind your hand. You could even think of the different fingers of your hand as being places that you're breathing towards. Like you could aim the breath towards one finger or another, or you could aim your breath towards the heel of your hand, which again, you want to have that resting below your eye. And so your other hand is still free. So continue breathing like this, but as you do, you're going to now bring up your second hand, and on the side of the nostril that you're breathing through, you're going to bring that hand to the ear on that side of your head, and you're going to cover your ear. And so both eyes are closed, and you're breathing through one nostril. And on the side where you're breathing, you've covered the eye and you've covered the ear. Now notice how the sound of your breathing has changed. And then, of course, you can feel your hand there on your ear. Breathe towards your hand that's covering the ear. Just imagine that you're sending your breath over to your ear. And then think of the space between your two hands. That's behind your eye, and it's a little bit more to the center of your skull, but next to your ear. And now slowly, without taking the hand that covers your ear completely away from your head, just move it away a little bit so that the sound changes, so that you can hear through that ear again. And breathe here a couple of breaths. And just notice if having the hand away from the ear again, if it changes the sensation a little bit. And then put the hand back. And again, you're looking into the eye that's covered. You're looking into the darkness. You're looking inside yourself, into your head. You're looking towards where you're breathing. As strange as that may sound, it's like you're trying to see inside your head. You're trying to feel inside your head with the breath. Now move the hand that was covering your ear to the back of your head so that it's opposite the hand that's covering your eye right now. So it's to one side of the back of your head. And think of breathing towards the hand and the back of your head. And then think of breathing again towards the hand that covers your eye. And then think of breathing to all the space in between, from the front to the back and over towards your ear. And of course, you can think of breathing to the top of your head, and you can think of the air that travels over the roof of your mouth on that side. You can feel the air rushing over the palate. And at the same time, you can imagine the space inside your mouth. Even as you breathe through the nose, just imagine the mouth expanding on that side with the breath. Imagine as you breathe that this whole side of your head expands out into your hands as you breathe. Okay, let it all go now. Rest your arms on the floor. And just take a moment here. Maybe it'd be good to rest on the floor for even about a minute, just to really tune in to all the sensations on the right side of your body and on the left side of the body. Just feel, where are you more open? Where do you feel more length? And where are you maybe a little less open or have a feeling that there isn't so much length? Just compare the side that you were working on and the side where you didn't do this yet. You can focus your attention first in your head, but then pay attention to the whole length of your body from head down to toe, along the right side and along the left side. And even if you go to do the other side, it could be very interesting for you to just stand up and walk around now to experience this one-sided feeling. Or you could stay on the floor and you could revisit some of the seesaw breathing movements that you've done in previous parts of this video series, expanding the belly, expanding the chest. Or you might even take this one-sided feeling into practicing the Wim Hof breathing. In any case, I hope this has given you yet another way of understanding the idea of breathing into your head, and I hope that this has been enjoyable for you. See you next time.